Welcome back. Or if you're new here, I'm so glad you found this channel. I started this channel because of my own health journey. I've faced serious health challenges myself, and I decided to turn that experience into something that could genuinely help people like us. Each week, I use the latest AI research tools to dig into cutting-edge medical information and translate it into plain English. And today's topic is one I feel strongly about. Heart disease is still the #1 killer of men and women over 65. 1 in 4 deaths in this country is caused by heart disease. Not cancer, not accidents. Heart disease. So let's talk about what actually happens, second by second, minute by minute, when a heart attack strikes. What is a heart attack? Now first, let's understand what's actually happening inside your arteries. Right now, as you watch this, over years, something called atherosclerosis has been quietly happening inside your blood vessels. That's a fancy word for the slow, dangerous buildup of a substance called plaque inside your artery walls. Plaque is made up of cholesterol, fat, calcium, and inflammatory cells. Think of it like rust building up inside a pipe. Now here's what most people don't realize. The plaque itself doesn't always cause the heart attack. What causes the heart attack is when that plaque ruptures. A piece of that plaque breaks off. Your body panics and sends in platelets to repair the damage, and those platelets form a blood clot. That clot can completely block your coronary artery, the artery that feeds blood to your heart muscle. And when the heart muscle stops getting blood, it starts to die. That is a heart attack. In medicine, we call it a myocardial infarction, literally, heart muscle death. The 6-minute window. Now I want you to really pay attention here, because this is the part that could save a life. Heart muscle is extraordinarily sensitive to oxygen deprivation. In the first 4 minutes after blood flow is cut off, cells in your heart muscle begin to weaken. By minutes 6 to 8, cells begin to die. Permanently. And hear the brutal truth. Dead heart muscle does not grow back. Whatever dies in that window is gone forever. This is why cardiologists have a saying, time is muscle. Every minute you wait, every minute you sit there thinking, it's probably nothing, maybe it's just indigestion, you are losing more heart tissue. Studies show that for every 30 minutes of delay in treatment, the risk of death increases by 7.5%. 7.5% for every 30 minutes. This is why calling an ambulance the moment you suspect a heart attack is not an overreaction. It is the smartest thing you could possibly do. The ambulance crew can begin treatment on the way to the hospital. They can give clot-dissolving drugs. They can perform an ECG. They can call ahead to the catheter lab. Time is everything. What happens to your brain? Now let's talk about something your cardiologist might not spend much time on. While your heart is in crisis, your brain is too. Your brain is the most oxygen-hungry organ in your body. It consumes 20% of all the oxygen you breathe, despite being only 2% of your body weight. When your heart's pumping capacity drops during a heart attack, blood pressure falls. Blood flow to the brain drops. This is why many heart attack patients feel sudden, overwhelming dizziness, confusion and disorientation, a strange sense of unreality or doom. Some people even briefly lose consciousness. But here's what's even more alarming. Research published in the European Heart Journal found that in the weeks and months after a heart attack, even in people who seem to fully recover, there is measurable cognitive decline, memory problems, difficulty concentrating, slower thinking. Why? Because when your heart struggles, tiny blood clots and microemboli, microscopic particles, can travel to the brain and damage small blood vessels. A heart attack and a stroke are, in many ways, cousins. And many heart attack survivors don't realize they've also sustained some degree of brain injury. Your kidneys, lungs and liver. Your heart doesn't work alone. It's the pump at the center of a complex, interconnected system. When that pump fails, the whole system is affected. Your lungs, When your left ventricle, the main pumping chamber, starts to fail, blood backs up into the pulmonary circulation. That's the network of blood vessels in your lungs. Fluid leaks into your lung tissue. This is called pulmonary edema, fluid on the lungs. You feel like you're drowning. That's not a metaphor. Patients describe it exactly that way. A wet, bubbly feeling. Desperate breathlessness. They call it cardiac asthma. This is an emergency within an emergency. Your kidneys. Your kidneys filter roughly 200 liters of blood every single day. To do that, they need strong, steady blood flow. During a heart attack, as cardiac output drops and blood pressure falls, your kidneys go into a state of shock. This triggers a condition called acute kidney injury, AKI, which occurs in up to 25% of heart attack patients. The kidneys respond by retaining sodium and water, which adds fluid to your already struggling cardiovascular system, making the heart work even harder. Patients who develop AKI after a heart attack have significantly worse outcomes, longer hospital stays, higher rates of complications, and greater long-term mortality. Your liver. The liver is often forgotten in heart attack discussions, but it shouldn't be. When the heart fails to pump adequately, blood backs up into the venous system. This causes congestion in the liver, a condition called congestive hepatopathy, or in severe cases, cardiac cirrhosis. Enzymes leak. Liver function is impaired. In severe cases, jaundice can appear within days. Your gut. Blood is shunted away from the digestive system during a heart attack, your body's survival instinct directing blood to essential organs. This causes nausea, vomiting, and intense abdominal cramping, which is why so many heart attack patients, especially women, are initially misdiagnosed as having a stomach problem. Let me say that again for the people in the back. Women having a heart attack are frequently misdiagnosed. Their symptoms are more likely to be nausea, jaw pain, back pain, and fatigue, not the classic chest-clutching Hollywood heart attack. Know these signs. For yourself. For the women you love. Permanent damage. So you've survived the heart attack. You're in the hospital. They've opened the artery, restored blood flow. You've made it. But your heart is not the same heart it was before. Where heart muscle has died, scar tissue forms. And scar tissue cannot contract. It cannot pump. It is electrically unstable. That scar tissue creates several long-term problems: reduced pumping efficiency. Your heart's ejection fraction, the percentage of blood it pushes out with each beat, may be permanently reduced. A normal ejection fraction is 55 to 70%. Post-heart attack, many patients drop to 40% or lower. Increased risk of arrhythmia. Scar tissue disrupts the electrical signals that coordinate your heartbeat. This can cause dangerous irregular rhythms, including ventricular fibrillation, which can be fatal without immediate intervention. Heart failure. Over time, the remaining healthy muscle tries to compensate by working harder and growing larger. But this remodeling of the heart actually weakens it further. This is how a heart attack becomes heart failure. Increased stroke risk. Blood can pool in weakened areas of the heart, forming clots that travel to the brain. And here's something I want you to sit with for a moment. A person who has had one heart attack is 5 times more likely to have another one. 5 times. Unless they make changes. Real, sustained changes. And that is what this channel is all about. Warning signs you might be ignoring. Now let's talk about the warning signs, because many heart attacks give you signals hours or even days in advance. These are the signs most people ignore or explain away. Number 1. Unusual fatigue. Not normal tired, but an overwhelming bone-deep exhaustion that arrives suddenly and doesn't go away with rest. Up to 70% of women report unusual fatigue in the days before their heart attack. Number 2. Chest discomfort. It doesn't have to be crushing pain. It can be pressure, tightness, heaviness, or even just a strange feeling of fullness. Many people describe it as an elephant sitting on my chest. Number 3. Pain that travels. Left arm pain is classic, but heart attack pain can radiate to the right arm, the jaw, the neck, the back, the stomach. Number 4. Shortness of breath, with or without chest pain. Many patients have breathlessness as their only symptom. Number 5. Cold sweats, nausea, lightheadedness, for no obvious reason. Number 6. A feeling of impending doom. This sounds dramatic, but it is a well-documented medical symptom. Many survivors describe a sudden, overwhelming sense that something is catastrophically wrong. If you or someone near you experiences these symptoms, especially multiple at once, here is what you do. Step 1. Call an ambulance immediately. Do not drive yourself. Do not wait to see if it passes. Step 2. Chew, not swallow, chew. A full-strength aspirin, 325 mg, if available and not allergic. Chewing gets it into your bloodstream faster. Step 3. Unlock your door so paramedics can enter. Step 4. Sit or lie down. Do not exert yourself. These 4 steps could be the difference between life and death. The lifestyle truth. I need to be honest with you now. And I say this with love because I've been there myself. 80% of heart attacks are preventable. 8% That number should make you angry and hopeful at the same time. Angry that nobody told you clearly enough. Hopeful because you still have time to act. The main risk factors, and I'm not telling you anything your doctor hasn't said, are high blood pressure, hypertension, high LDL cholesterol, type 2 diabetes and insulin resistance, smoking, physical inactivity, obesity, especially abdominal fat, chronic stress, poor sleep. This one is massively underrated. Excessive alcohol. Now here's what's exciting. And this is where the latest research gets genuinely thrilling. We now know that even in people with significant plaque buildup, lifestyle changes can actually stabilize and even partially reverse arterial disease. Studies from the pre-dimed trial showed a Mediterranean diet reduced major cardiovascular events by 30%. Exercise, even just 30 minutes of brisk walking 5 days a week, reduces heart attack risk by up to 35%. Quitting smoking, even at 65 or 70, the risk begins dropping within hours of your last cigarette. And emerging research on GLP-1 medications, the drugs behind the weight loss revolution, is showing dramatic reductions in cardiovascular events in overweight patients. The science has never been more on your side. You are not too old. It is never too late. So let me bring it all together. A heart attack is not just a heart problem. It is a whole-body emergency that can permanently damage your brain, lungs, kidneys, liver, and gut, and leave you with a heart that will never be quite the same. But you have power here. Learn the warning signs. Don't wait. Call the ambulance. Chew the aspirin. And long before a heart attack ever threatens you, make the changes. Today. Not Monday. Not after the holidays. Today. I made this video because information is the most powerful medicine there is. If this helped you, please hit that like button. Share it with someone you love. It might be the most important thing you share this year. Subscribe so you don't miss our upcoming videos on blood pressure, cholesterol, and the shocking new science on reversing heart disease. And drop a comment below. Have you or someone you know survived a heart attack? What do you wish you'd known? Let's learn from each other. I'll see you in the next one. Take care of that heart. It's the only one you've got. Remember to stay healthy and avoid hospital. When your time actually comes, at least you will die fit. Bye for now.